This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
If there's any age limitation around individuals considering IVF. I know this is a very popular question. And another one from Carol is the process painful?
Sure.
And one more from Jade after that. I'll wait for you.
First of all, in general terms, the process is not particularly painful. That's easy for a male to say, but no, our experiences are that the day of the egg collection, because we're putting a needle through the vagina and perhaps causing some bleeding, there's a little bit of pain associated with that, but mostly it's all over within 24 hours, and that's about it. Age limits, okay. Unfortunately, age makes a difference to success rates. That women's eggs, as you get older, become less fertile. And because of that, women in their 40s are much less likely to get pregnant than younger patients. That doesn't mean we can't try, but you've still got to be producing eggs. So certainly women at 50 shouldn't be thinking about going through IVF, at least with their own eggs. They can use other women's eggs, although most clinics in Australia put a limit of menopause age, which is 51, on using donor eggs as well. There are clinics in the public sector that limit the age to 42 on the basis that with limited resources, it should be concentrated on women who have a higher chance of getting pregnant. Personally, I do treat many patients in their late 40s, not with the particular optimism of a pregnancy, but I certainly see it as the bringing to a conclusion their childlessness. It's a hard thing to accept that you might, having decided now you want children in your 40s, that it's not going to happen. And to not do IVF, and I've had a number of patients say this to me, to not go through a cycle and see whether I can, means that in 5 or 10 years' time, I'll look back and say, I didn't do everything I could. And I certainly therefore justify doing it, albeit with very strong counselling in relation to their chances of success. The reality is that at 45, the odds of a pregnancy are probably in the order of 0.5%, 1 in 200. We looked at 800 patients who'd been through IVF cycles over the age of 45, and there were 2 pregnancies in 800 patients. That's how rare it is. So it's pretty hopeless, but women still come to me and say, I might be the next one, and therefore I want to go through treatment. And I think that's justified. Some of my colleagues won't do that.
Another question live, Prof, from Jade is, what can cause zero sperm in semen samples with previous samples having poor sperm quality but not completely zero sperm?
Unfortunately, there's a slippery slope towards zero sperm. And in fact, a paper we published showed that something like 15% of men who've had a poor sperm count ended up with no sperm 6 or 12 months later. So we always advise freezing that sample if we've got a poor sperm count, because it's likely it's going to get worse.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.